All right, so we've been seeing a ton of things, especially with our speed athletes, with hip flexor issues, ASIS pain, rectus femoris pain. We've even seen an onslaught of what we call sports hernias, which that's kind of up in the air, even what we're treating, but we're treating something that basically is in this anterior aspect of the hip. If you look, almost everywhere we seem to treat seems to be highways of fascia, muscle, and nerve. So if we look and we start removing some of the layers of this area, you start seeing the deep structures of the hip flexors, iliacus, psoas, and all these structures can become painful. And really, especially with our athletes, we're looking at iliacus and psoas coming down, okay, on an insertional area, on the insertion of a common insertion on the proximal femur. And this area becomes painful because of a tendinopathy. There's burses there. The ASIS, which is part of the ilium, is there. We can also have SI dysfunction that can affect this area. So it's an area that we tend to treat a lot. It's painful, can limit our athletes on what they're doing, and we've had some really good success with a very simple tape job that we do to unload the anterior hip. So we're going to remove the anatomy, and we're going to come here. We're going to kind of work our way through what we're taping. So what we found is that we used to come just over on the ASIS, but found that that didn't work, and usually the ASIS will be painful. Okay, because there's an area of an insertion there of a rectus, and some of the other fascial areas create pain there. So we want to be just proximal to the ASIS. We're going to come just right in front of the hip. We take one strip of tape, and we're going to finish just medial, on the medial part of the thigh. Okay, so it's simple and easy tape job. Males and females, we just kind of keep the shorts on. I come just above the ASIS, and then I'll come underneath, and I will grab the tape and I'll bring it through so that I can find the tape here. I'm going to apply tension, okay, lay the tape down and finish on the medial thigh. If you notice, I did it, kept the shorts on, real simple, real easy, but now I'm unloading the anterior aspect of her hip. It's really remarkable the results we get with this. You can actually treat through this. We've done dry needling along the rectus on both sides with this. You could actually take another strip if you wanted to, if they have more lateral pain. We'll take a shorter strip and just unload, and almost getting into the IT band, but not. We'll start just lateral to our first strip of tape, okay, and kind of do the same thing. Come underneath, minus that. Again, come underneath until I can find the tape again. There I have it. So all I'm doing is finding where the tape and the paper meet, applying my tension, laying it down, and then finishing with paper off tension, just lateral that. So now I've got a nice hip flexor and anterior hip unloading sequence, if you can see how that works. And again, it's done real simple, real easy, no need to disrobe. And as long as you kind of keep your technique and just make sure that you're on the skin, you get a good result. Tons and tons of unloading with this, tons and tons of results that we've had with this. On top of, we'll do Graston, dry needling, we'll do tons of treatment in this area, but it's just a very sensitive area to go into and treat. And this is something that the client can keep on and unload throughout the day.